Hello and welcome to Two Peds in a Pod, the medical education podcast from the Children's Emergency Department in Derby. I'm Ian Lewins, one of the consultants, and I'm very pleased to be joined this afternoon by Graham Johnson, one of my consultant colleagues, and we are going to talk GREATIX this afternoon.
Yeah, indeed.
Graham, I know all about DATIX because that's what people fill in when I'm rude to them, and I get a shirty email saying, stop being rude to people. But GREATIX, what is GREATIX?
Okay, so GREATIX in Derby, that's just our name borrowed from the Leicester Group of trying to expand on the Learning from Excellence movement that really started at Birmingham Children's by Adrian Plunkett. So it's all to do with recognising excellence and best practice and ensuring that there is wider learning from things that go well, as opposed to the DATIX system, which is all about learning from errors and learning from mistakes. The GREATIX, or Learning from Excellence, Safety 2, whatever you want to be calling it, is learning from the other end of that normal distribution curve, learning from all the good stuff that we do, because we do loads and loads and loads and loads of good stuff, and we feel that it doesn't get mentioned enough.
Yeah. So obviously, DATIX, I think most people are familiar with, is something goes wrong, somebody fills a form in, it goes to a manager who goes, tut tut, isn't that a shame? And we try and learn from it. But as you say, that's a very small amount of the stuff we do. And I think what Adrian and his team saw was, as you say, hang on, we do an awful lot of really good stuff. There must be some learning to come from that. And that's kind of where it's come from, is my understanding.
Yeah, absolutely. Yeah, and I think I've seen Adrian talk a couple of times, and I think it all started with a tweet.
Right.
I think it was something like 2014. He said, "Can't we have an anti-DATIX?" And from what I understand, it's all kind of snowballed for him and his team from there. And they've got their Learning from Excellence website with kind of their story and how they've developed things.
Okay, so you are part of the GREATIX team. Why did you get involved in that? What was?
I just thought the idea was really, really good, and wholeheartedly agreed with the principle that often we've just completely failed to recognise the good stuff that we do every day, and it never gets recognised. And there's, I think, as the senior on the shop floor with a big team, it is sometimes difficult to get around everybody and say, well done, that went really well. And I don't think we recognise it enough. You might have it could be something from a really well led trauma or sepsis case, or just a really nice patient interaction that's gone really well for whatever reason. I don't think we recognise some of the little pockets well enough, and I thought that was something that we could bring to Derby really nicely. I think that we've got a good reputation for teaching, and I think fostering quite a nurturing environment, and it just seemed like a big gap that we weren't doing this as a matter of routine.
Okay. So some people might look at that and say, well, okay, I can see that there's a benefit to morale, maybe saying thank you, well done, those sorts of things. Some people might say, well, hang on, a lot of places, and here at Derby we have something called the Pride of Derby Awards, which is sort of, you can get nominated for by patient, parent or whatever, and that's sort of saying, well done, thank you. What's the sort of difference between the Pride of Derby Awards, for example, and GREATIX?
Okay, so you're right. There is a big morale part of it, but the Pride of Derby is excellent in doing that and recognising things that have gone well. But the thing with the GREATIX and this whole movement is really to ensure that there's organisational learning from stuff that has gone well. Excuse me. So we generate people can nominate someone for a GREATIX, and the team will review these, and if there's something that we think actually that really needs sharing more widely, what went particularly well with that, we need to be emulating that and doing it. That needs to happen every time in that situation, not just be exceptional. So this is more about the learning as opposed to just I don't want to say just a pat on the back, but it's trying to make sure that there's learning from it as well.
Right.
So it is taking the the IR1, the GREATIX thing, where we're trying to get learning from things that go badly, it is literally just flipping that on its head and trying to learn from all the good stuff.
Okay. So how have you sort of set up the system then locally?
Okay. So how we started, and I should recognise my colleague Andrew Tabner, who has really led on this.
Yes.
Who's not at work for the next few weeks. So we had a look at the Learning from Excellence website, which has some excellent resources and advice on how to do it. And we toyed with the idea of having a paper system, but talked to some of our team in IT, and they said that they had a very simple site that they could set up and make it nice and easy. So we started that way with a with a publicly facing website that you could just click the button, submit, and it was a very short form with the name of the person that you were nominating, an email address for them if you had it, and it just got sent to a mailbox. And we thought the advantage of having it outwardly facing was that people could do it at home, because one of the things with the GREATIX, one, it's quite a long form.
Yeah.
And people will often end up doing them at the end of their shift, and we certainly didn't want it to be that kind of thing. So when people were sitting at home and reflecting, actually that went really well, making it nice and easy for them to be able to do it either on their smartphone or on their PC. We thought that would be the best way. So we started that like that, and it just kind of grew from there. And that's exactly the advice and the experience of the team at BCH. They said that it would generally just seep out and grow organically. So we started it just off in the ED and the CED to see how it went, and promoted it there. And then when we started getting nominations for, say, our surgical colleagues or anaesthetics colleagues, and it started nudging its way out of the department, we thought, okay, so now it's time to try and expand it a bit more formally. Actually, we went to the LFE conference that was last November, and what we found some of our radiotherapy colleagues were there as well, and they were doing it in their own way. They had a paper-based system within their own department. So now we've kind of joined forces with them a little bit, and so now the website now has we've got dedicated leads in each department in the hospital, with a couple of gaps, but generally across the whole hospital, and because it was starting to get a bit, we were starting to get quite a lot of nominations, and so we felt it was best to have a lead within each department who could best decide which submissions warranted having a bigger meeting about. So the what called IRIS meeting, so a bigger meeting to discuss what learning the department could have from them, which we were just starting to struggle to be able to maintain that just between the small team that we had within the emergency department. Sure. So we've kind of expanded like that.
So if somebody can click on the link on Flow. Yeah. They can do it at home. They can do it anywhere, and I think that's really important.
Yeah. So if you put Derby GREATIX into Google, you will see our submission page.
Okay, so it comes up, you fill in your details, the person that you're nominating, why you're nominating, what sort of learning you think you can get from that. Yeah. You send it off. What then happens to that email? Who sees it? And
so now it will go to, so let's say the surgical registrar gets nominated by someone within the ED. That nomination will go to our lead in surgery. If the nominator knew the email address of the person that they were nominating, then they can fill that in, and it would automatically go to them. Otherwise, it would be the person who is kind of dealing with the admin to inform them. But we try and make it as automatic as possible if people know the email address, and so they get an email saying, what have you done that has meant that you've been nominated for a GREATIX.
Okay. Now let's assume if it's something that you say you stayed 30 minutes late or you work particularly hard, I guess you'd sort of say, well, there's not an awful lot of learning potentially to come from there. But if somebody did something that you thought, actually, that's a really good idea, what you've done, we should use that. Yeah. How do you dig into that a bit deeper? What's the process?
So I'll use an example that we had in adult emergency. a few weeks ago. So we are a trauma unit. We're not a trauma centre. So our sick trauma patients who come here, we stabilise and move out, and we try and do that as quickly as we possibly can. And we had a patient come in with a stab wound who we managed to intubate, ventilate, turn around, transfuse, and get out of the door within 18 minutes of their arrival, which is exactly how it should be. But anyone who's been in this situation, it is seldom as slick as that. So, we heard about that. Right. Okay. So what exactly went right? So then we have a meeting with the members of the team about what. And to discuss through exactly what happened, and you're trying to find out how did it. So it is the Swiss cheese. It's not why exactly did the why did the holes line up so well in that case, and how can we emulate that? How can we do that again? So we have we talk with those who were involved, and have a talk with so we've had a discussion with our lead for trauma and that sort of thing. And it was actually a lot of what went well with that. It was ownership by the nursing team as well. So it's about promoting then that what they did within all the different professional groups that contributed to that patient's excellent care there.
Well, that's quite a different way of thinking of why did it go well. We just I think it's often thank goodness it went well, and then we'll learn from when it goes wrong. Actually, that's a very different way of thinking about it. Why did it go well?
Yeah.
I'm glad it went well, but why?
Yeah.
And you touch on briefly this concept of these meetings, these IRIS meetings. What does that involve, and what's that about?
Well, so that's the meeting that we've had. So we've had a couple here within children's emergency, and this one from adult emergency. We've had one with our medical colleagues as well, and that is again. So any serious untoward incidents from the GREATIX side will have a meeting of relevant people. Discussing what and picking apart the case about what went wrong. This is doing exactly the opposite, and then picking it apart to find out exactly what went right. Yeah. And that's what we do there, and then try and generate some actions from that. Yeah,
and that's a fairly sort of structured interview at times. Isn't it?
And I know I keep on mentioning the LFE site, but so when we did our first one within the children's emergency, we didn't really know what we were doing. Unfortunately, the site has an excellent suggested structure for how you're going to go through the meeting. So we very much just followed that. To be honest, until I think we will continue to crib from that until we find our own way with it, because it is really helpful to have that guidance, suggested ideas for things to discuss and whatnot. So.
And it uses this idea of appreciative inquiry.
Yeah.
And what's your understanding of that?
So I managed to get onto the latter half of a training day that the trust happened to be putting on, and it's asking questions in a supportive way, really. There was a lovely stat that was brought up at the LFE conference about civility and how rudeness makes you more stupid. I forget the exact numbers involved, but this is so therefore doing the exact opposite of that. It's asking things in a nice way and supportive way to get the best out of everybody.
Okay. So for those people who say, God, this all sounds a bit wishy-washy, airy-fairy, pat on the backy.
Yeah. So I did feel a bit like that myself going into it. But it really works. It does. And I know exactly what you mean. But I think when you see it in action and you see the benefits that that can come from it, I think your opinions will be changed. One lovely example that we had from adult emergency. Our biggest surge in increasing numbers and getting the word across was one of our receptionists got nominated because she really dealt with some relatives in a really, really nice way, and they're very, very supportive of them. And someone nominated her for a GREATIX, and she did not shut up about it for about a week. She was which was brilliant. She was so made up from that, and the word obviously got around that of what she'd done. So that then filters down through the reception staff and other staff as well. And so I think it is greatly underestimated how much good this can do for everybody, from individual staff and morale, but to organisational learning.
And I think for those sort of thinking, oh God, it's another form to fill in.
Yeah.
When you compare it to the GREATIX form, which is lengthy and is, you sort of lose the will to live halfway through, and you think, do you know what, I can't be bothered.
Yeah, no. So we very much recognise that. So the form that we've got online it's literally your name and contact, who you are nominating, and their contact if you know it, and a very brief explanation of what they did that was good. It is as simple as we could possibly make it.
So it's 5 minutes, if that.
If that. Sitting on the bus, sitting on the train, on your phone, you can do it. We've met with our GREATIX team here about it, because GREATIX is actually the company name. It's not a verb, although it often gets used as a verb.
I'm going to GREATIX you.
Yeah, I will be GREATIXing you. And they are very mindful of the fact that their form is unwieldy and dull to fill in and a bit of a chore. And they are actually looking at having a module developed for recognising excellence as well. And they are going to similarly, I think, go for something far simpler. But the advantage from an organisational point of view is that it will all sit within the same database then, and from our point of view there'll be a little less legwork. But we're very much about keeping it as easy to do as possible.
Yeah. So we've started in ED. Mm-hmm. It's now starting to hopefully grow.
Yep.
Organically, and is that the sort of the idea? Is that it will grow, and as people get used to it and people become familiar with it,
it's all word of
it'll
mouth.
happen more.
Yeah, and that's exactly what we're seeing. So we started off with 1 or 2 nominations a week, and they were mostly from me and Andrew.
Nominating each other.
Well done for setting up GREATIX. No, nominating people, and then a little bit of nudging. Oh, someone, you hear someone praising somebody, says, "Oh, why didn't you GREATIX that? That would be good." And letting it trickle through like that. And then, as I said, when we started getting surgeons being nominated in the anaesthetic team, medical registrars getting nominated, we thought, okay, right, this is now the time to start trying to engage our colleagues in the wider hospital. And then, so we've gone from maybe once a week to getting 4 or 5 a week, and then so I suspect that the other specialties that are now doing it will start with a similar slow drip, and then it will gradually increase. And I think that's been seen. I think that's been seen everywhere. I don't think we'd be unusual in that kind of experience.
Because when I went to the same conference as you last year, and there is another one in November this year, rather. And I can't remember where it was. I think it was Southampton, where they started off with 1 or 2, and then it became hundreds over time. And it became just something that you did. It's something embedded in the ethos. Yeah. And that can only be a positive thing.
Yeah, absolutely.
So for those people who are thinking, that sounds a really good idea, I'd like to start something up.
Yep.
Where would you point them to? Where are the resources they can go to?
So the Learning from Excellence website is just the main place to go, because it hosts everything. There's loads of materials that Adrian and his team have put together, from a starter pack, literally a how to get going. Very happy to be contacted here. If you wanted to get in touch, then we could tell you about our experiences more one-to-one. But yeah, I'd certainly just go to that site, because it just makes it all so nice and easy.
So that's learningfromexcellence.com, possibly.
Okay, it's just in my favourites
now.
Yeah. I just click the button in my toolbar.
So, Learning from Excellence, that's what we should Google, and it'll all be there. Yeah. Fantastic. Thank you for coming to spend the time with us and having a chat. I shall now fill in a GREATIX to say thank you.
Okay.
But thanks for your time, Graham. Cheers.
Thanks, Ian. Cheers.